Hello, my name is Milica Ognjenovic, the first author of the article The Risk and Consequences of Vertebral Fracture in Patients with Ankylosing Spondylitis, a population-based data linkage study. Ankylosing spondylitis is a relatively rare type of arthritis characterized by chronic spinal inflammation contributing to bone loss and paravertebral calcification with syndofomite formation, which in turn leads to spinal rigidity and reduced bone density, making patients susceptible to vertebral fractures. Therefore, here we investigated patients with ankylosing spondylitis compared to their controls, their long-term prevalence, incidence, and risk factors of vertebral fractures. This study is based on administrative health data, including ICD-9 and ICD-10 codes covering all private and public hospitals in the state of Western Australia here in Australia from 1980 to 2015. Therefore, AS patients were identified as having at least one appropriate ICD code, while controls were defined as those who did not have any rheumatic disease and hence had no relative ICD code. A total of 2,321 AS patients were matched to 22,976 controls based on their date of birth, sex, Indigenous status, and year of first hospital contact. Overall, AS patients had a greater prevalence of vertebral fractures at 9.3% compared to controls with 2.5%. Our ankylosing spondylitis patients showed an average 2.5-fold increased risk of developing a vertebral fracture compared to their controls after adjusting for age, sex, and osteoporosis. Interestingly, though, the extra-articular manifestations of ankylosing spondylitis were not risk factors of vertebral fracture, although the risk of vertebral fracture tremendously decreased after the 80s decade. However, this risk was not altered in the 2000 era, whereby following the introduction of tumor necrosis factor inhibitor treatment. Ankylosing spondylitis patients had a greater incidence of developing new vertebral fracture at 6.8% compared to 1.9% in controls, resulting in a nearly four-fold risk. Specifically, the ankylosing spondylitis patients were more likely to fracture the cervical section of the spine from C3 to C7. They were also 4.6 times more likely to have a recurrent vertebral fracture compared to their controls. Overall, we found no increased risk for mortality among ankylosing spondylitis patients, despite observing them developing their first vertebral fracture a median of 5 years earlier at 71 years of age compared to their controls. Thank you for taking appreciation into our study, and please do check out our full article at the Journal of Rheumatology with the DOI reference below.